Hey everybody, I'm Dr. John Willardson, and thanks for watching. So over the weekend, I was in Utah, and as I was driving down the freeway, I swear every other billboard was an All-on-4 billboard. And one billboard would say, "We are the cheapest in the state." And then the next billboard would say, "We're the best in the state." But it happened to be that it was the same company. So I'm not sure how you can be the cheapest and the best. It's an oxymoron. And so as we look at the procedure of the All-on-4 procedure, the reason that these companies are pushing All-on-4 so hard, it's to place 4 implants. As a resident, we would say, a monkey can place 4 implants. It takes somebody who understands surgical technique in order to provide patients with the most ideal treatment. For example, with an All-on-6 or an All-on-8, many times, most of the time, you have to do a sinus graft. And that gets out of the realm of the skill set of these doctors who are doing All-on-4 because they're avoiding the sinus. They're avoiding putting implants in the sinus. And so as a result, it's compromised treatment for the patient. So on these billboards, as I'm driving down the freeway, I'm seeing All-on-4 for $15,000. But in order for that to happen, they have to use the cheapest implants available and the cheapest materials, prosthetics, and definitely they're not grafting the sinus. Even though $15,000 is a lot of money, it's wasted money if the procedure is not done correctly and you end up with a fractured prosthesis, failed implants, or you don't end up with a result that is what you're expecting or what you need. Patients need their molars replaced. And most of the time with the All-on-4, because of the positioning of the implants, they're not able to replace the molars because of the cantilever effect. Like I've shown on the x-ray, that there's such a large cantilever in order to get back to the second molar that it's just not possible. Not to mention the amount of force. There's a lot of force when you bite down, and so that area needs to be supported by implants. But in order for these corporate All-on-4 implant centers to place implants in the back of the upper maxillary jaw, they would have to graft the sinus. It adds costs, it adds time, and it adds training. You have to know how to do it. So they'd have to go do a weekend course and learn how to do a sinus graft in order to provide an All-on-6. But the best procedure for patients who are missing teeth, losing teeth, have lost their smile, and have to have their teeth removed is to have implants in the most ideal position throughout their mouth. And so looking for the cheapest cost or just the fastest procedure usually is not the answer. The answer is finding somebody who has training, who knows how to do this procedure correctly, uses the very finest quality materials, implants, graft material, prosthetics, and then go with somebody who knows how to do the procedure and is going to give you the very best option and solution. Looking for the cheapest price or going off of a billboard generally is not, it's fine if you're buying a car or if you're having to do a refinance on your house. But when we're talking about your health, when we're talking about a procedure that needs to last the rest of your life, it's usually not the best place to find the doctor to do this procedure, especially implant surgery, implant prosthodontics. It's very detail-oriented, very technically demanding, and it requires a lot of training, background, and a lot of experience. I'm Dr. Willardson, and today we're discussing the difference between the All-on-4, the All-on-6, and what to look for in a surgeon and a practice who are providing these services. Thank you for watching, and we'll see you soon.